Image perception. Image perception plays a crucial role in applied medical image processing, as the accuracy of medical image analysis and interpretation heavily relies on the correct perception and understanding of the images by medical professionals. The use of advanced computational techniques in medical image processing can help to enhance the visibility and clarity of medical images, making it easier for medical professionals to perceive and interpret the information they contain. For example, image processing techniques such as image segmentation can help to separate different structures or tissues within an image, while image registration can align multiple images from different modalities for more accurate diagnosis. The design and optimization of image processing algorithms for medical image analysis are informed by the principles of image perception, to ensure that the output is consistent with how a human observer would interpret the image. MTF of the visual system. MTF stands for Modulation Transfer Function, which is a measure of the ability of a system to transfer spatial information from an object to an image. In the context of the visual system, the MTF refers to the ability of the human eye to transfer the spatial information of an object to the visual cortex, which is responsible for processing and interpreting visual information. The MTF of the visual system describes the contrast sensitivity of the eye as a function of spatial frequency. In other words, it describes the ability of the eye to distinguish between different levels of contrast at different frequencies of light. The MTF of the visual system is influenced by several factors, including the size and shape of the pupil, the quality of the eye's optics, and the neural processing of visual information in the brain. The MTF of the visual system is important in medical imaging, particularly in ophthalmology, where it is used to evaluate the quality of the eye's optics and to diagnose and monitor eye conditions such as cataracts, glaucoma, and macular degeneration. In addition, the MTF of the visual system is also used in the design and evaluation of imaging systems such as cameras and microscopes, to ensure that they can produce images that are consistent with the way the human eye perceives spatial information. Image fidelity criteria. Image fidelity criteria are quantitative measures used to assess the quality of an image compared to an original or reference image. The criteria evaluate how well the image preserves important features and details of the original, such as edges, contrast, and texture. There are several image fidelity criteria that are commonly used in the field of image processing, including peak signal-to-noise ratio, PSNR, a measure of the difference between the original and the processed image in terms of the amount of noise introduced during processing. Structural Similarity Index, SSIM, a measure of the similarity between the original and processed image in terms of their structure, luminance, and contrast. Mean Squared Error, MSE, a measure of the average squared difference between the original and processed image pixels. Universal Image Quality Index, UIQI, a measure of the similarity between the original and processed image based on their spatial and frequency domains. Visual Information Fidelity, VIF, a measure of the perceived quality of an image based on the amount of visual information preserved in the image. The choice of image fidelity criteria depends on the specific application and the goals of the image processing task. For example, some applications may prioritize preserving fine details and edges, while others may prioritize color accuracy or overall image brightness.